Hi, everyone. Hi, Dr. Hayat. Just for anyone who is both in the audience and in the panelists, our live stream has started. So I know some of the viewers are watching via live stream as well.
Okay, all right. Is it far away my image or is it fine? Joanne,
Oh, yes.
is my image far away or you want me to come closer?
Maybe if you could come closer, that would be wonderful. Thank you.
When I speak, will be that the projector come to my face or going to be like this?
Yeah, maybe if you could sit a little bit closer. You seem far away.
Okay.
Thank you.
Hello, Dr. Cindy. Hi, Dr. Cindy.
Hi, is that still far away?
What I wanted to find out from your cameraman, can he just zoom in on you closer?
ممكن أحط هنا شوف.
Oh, perfect.
بس إنه أطالع وجهي فوق. أنا طالع الحين. طالع فين؟
That looks great.
So I can look to the camera like this.
Yes.
It looks wonderful, Dr. Hayat. Pleasure to see you again. It looks great.
Nice to see you. So
Are you able to see the slides from where you are?
I can see the
main slide.
Yes, I can.
Okay, just say next slide and I'll advance your slide for you.
Okay, next slide, please.
Oh, during when we start.
Okay, I'm ready.
Okay, great.
So I think we're waiting for, no, go ahead, Dr. Hayat.
So shall I look at the camera? Is it better like this? So it will be directly to you?
Yeah, to the camera would be wonderful because we have already about 35 people on the live stream. So yeah.
Okay.
I believe this might be Dr. Stevens. Let me verify first. I'm not sure. There's somebody named Lisa.
Yeah, that would be her.
Okay, her microphone is not connected. Do you know what number she's calling from? Do you know what number she might be calling from?
No, Charlotte.
That's it. كمان عليه اليمين شوية.
You know what, Alan, why don't you move Diana into the room for a second? Person level Diana Rubin. She may be able to assist with Dr. Stevens because I'm not recognizing all the names, but I do recognize Diana's name. Diana, we're having problems reaching Dr. Stevens.
Joanne,
Diana?
hello, can you hear me?
Yes.
Yes, hello, can you hear me?
Yes, we can hear you, Diana. I think we're having problems reaching Dr. Stevens.
I'm just writing now to Lisa. What would you require from her side?
Is she in the room yet? I see a person named Lisa, but I don't know if that's her or not.
It should be her. It should be her.
Okay, she must be dialing in by phone. Do you know what phone number she's using?
I don't know. It could be from her mobile because
Can you give me just the last 3 numbers of her mobile?
Yes, let me check. It is, I can tell you right now, it is the last 3 numbers of her mobile are 360.
Okay, so that's not her. And so can you get in contact with her and see if she's having some issues connecting?
I already did.
Okay.
Yes, I already did. Can you see me or just hear me?
I just hear you right now.
Hear you.
Good. Okay, that's great. That's what I wanted to check. I've informed her, I've informed Anya, Dieter, and Kendall, my other colleagues, that I'm already with you and that you're trying to reach Lisa to bring her in the room. And I suppose they will react shortly.
Thank you.
ما طالع صح؟ ما طالع صح؟ تحت الكاميرا تحت الكاميرا فين؟ احنا على الكاميرا لايف ستريمينج تبي الصوت صار شيء أقول لك الإضاءة مرة بدائية الإضاءة مرة وحشة أقول أسأله إذا كان
How is everything there, Dr. Hayat?
It's just like we're just fixing the camera, but it's fine now. Is the lighting okay?
Perfect. Yes.
Can you hear me, Joanne? Just a quick update from Lisa's side. Can you hear me?
Yes, we can hear you.
Okay, great. So Lisa is connecting. She's just finishing some interviews that she had up to now, but she's aware. I've informed her, I've informed the colleagues, so she's connecting like any minute now, right? Now I got the information that she is connected and she will connect via audio. Okay, so she should be there. Great, yeah.
Okay, I'm standing by waiting for her to connect.
Dr. Hayat, I guess while we're waiting and we have, audience members on the live stream, I thought maybe if you talked a little bit, given your passion for the initiative and also, a little bit of, personal perspective of how the partnership came together, since, we have some members. I think we have about 30 people on the live stream.
Yes, great. As you know, everybody aware of the developing world or the poor around the world, they're really deprived from the benefit of science and technology and innovation. And actually, innovation, the way of innovation, how it started and created it actually for the needy. And if we look around, many people are deprived of that benefit. And that's also when His Excellency found out that the highest number of the women who die from breast and cervical cancer are concentrated in the top 3 countries, actually, all of them 3 from our member countries. And what is dying about that, they may die from a preventable and treatable type of cancer. Can be prevented by a vaccine like cervical cancer, it costs $10, or so many now innovative and medicine and innovation came so far for radiology and surgery and diagnostic can prevent the life of women. And remember, when you lose a life of a woman is a family, is a community, is the whole society. So the whole idea of that, how we can do something about it, and how, because we are also, as the Islamic Development Bank, has committed long time ago to fight against the global fight against cancer. So we partnered with the IAEA to be able to create a new program, a new platform, to be able to have the whole holistic solution, not just only treatment diagnostic, but also innovation, training, capacity building, because the IAA, they have a huge experience in training, their own resources in capacity building and diagnostic. So it will be perfect partnership for both agencies who are committed, which committed for a long time for this type of treatment. And that's the whole idea came together in terms of we value very much our partners, and especially partners who can also share with us the same passion. And we cannot do that alone. Nobody can do everything alone, especially with the global goals. It's a new era, and we need to really partner to be able to have the better impact, and the impact will be much visible. And that's why we're having this webinar today, how we can call our partners around the world to be able to join us in this a new exciting initiative for us with the Islamic Development Bank and the IAEA.
Great, thank you so much. And you know, we've always been so inspired by this work, and thank you for giving that, you know, that overview while, you know, before we got started, because I know that the viewers were really wanted to hear from you. So thank you so much.
Thank you.
I'm noticing the amount of attendees come in as you were talking. So we have about 23 attendees, you know, on the webinar. And then also on the live stream, I'm being told we have another 40 or so. So thank you so much for this. So I guess we, you know, we'll get started. And
stand by. Joanne, wait for the recording light, and then we can begin. Give yourself 10 seconds afterwards.
Getting used to all this new production. So thanks again. So you know, I think, you know, the purpose of the webinar, I'll begin and then we'll do some introductions of the attendees as well. But in terms of, you know, why we're here today, both in the live stream and also with the participants within the webinar, is really, you know, as Dr. Hayat was saying earlier, to really showcase, you know, why this is needed right now, right? We're, you know, in difficult times with COVID-19, and, you know, women still need essential services. So I'd like to turn it over both to Dr. Hayat and Dr. Stevens just to give a brief introduction of themselves, and then we'll have a chance for the attendees just to say their names and also what organization they're with. So Dr. Hayat, I'll turn it over to you, and then Dr. Stevens for a brief introduction before we turn it over to the attendees.
Thank you very much. Hayat Sindi, the Chief Advisor to His Excellency Dr. Bandar Hajjar for Science, Technology, Innovation, also the Supervisor of the Media Department and International Relations.
Great, thank you. I'll go ahead. Hello, everyone. I'm Lisa Stevens. I'm the Director of the Program of Action for Cancer Therapy here at the International Atomic Energy Agency. I've been with the agency for 1 year and have had the pleasure and the delight to work with Dr. Hayat and the Islamic Development Bank, as well as the Center for Global Health and Development. So looking forward to the conversation today.
Thank you so much. And I will turn it over to the IAEA to introduce themselves, and then to some of the members on the audience. If, for time purposes, you can give your first and last name and your organization. We'll have a lot of time for discussion afterwards.
Yes, good morning, good afternoon. Anja Nitsche here from the IAEA, working with Lisa, and here together with my team. Maybe due to time, I quickly introduce the team. We are here with Diana Rubin. We are here also with Dieter Eckert and with Kendall Sievert. Very nice talking to you.
Hello, nice, good to talk to you.
Great. And then over to the ISCB team.
Yes, hello, this is Abdelaziz Al-Tohi, Legal Counsel from IDB.
Hello, this is Ammar, Senior Global Health Specialist, Dr. Hayat's team.
Assalamu alaikum, Yusri Ben Yusuf here from Global Partnership and Resource Mobilization together with other IDB team.
Hello, this is Ammar Abdo Ahmed, Senior Global Health Specialist, ISDB team.
Hello, this is Abdul Kader from ISDB team.
Great, thanks so much. And then I know we have speakers from the Friends of Cancer Patients. Okay. So thank you so much. I think the attendees are having, I think one of them is having an issue with the microphone. So what we'll do is we'll turn it over to the panelists, and during the Q&A, we'll have more interaction.
Hi.
Oh, hi, can you?
Yes, I can hear you. I'm sorry, it was on mute. This is Hala Al-Humaidi from Direct Aid Society based in Kuwait.
Thank you for joining us. I think we're still having mic issues. And from the Sahara Breast Cancer Association. Okay.
Hi, Sharifa from Zahra Breast Cancer Association. You hear me?
Yes, we can hear you. Thank you for joining us. Thank you so much.
Yes, hello. Can you hear me?
Yes, we can hear you.
Yeah, this is Ammar Shafi from the Islamic Development Bank. Thank you.
Thank you so much. So we'll turn it over now to the speakers, and we'll begin with Dr. Hayat's presentations. During the discussion period for the attendees, I know some of you had questions ahead of time, so if you raise your hand, the technician will lead you into the room, and then you can ask your questions. So at any time, if there's any questions or any other discussion points, if you raise your hand, you'll be moved into the room. So Dr. Hayat, we'll turn it over to you to give us further information to your discussion earlier.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Wassalatu wassalam ala ashraf al-anbiya wal mursaleen. Eid Mubarak, everyone. Happy Eid, happy Adha Mubarak. Sorry, we had to drag some of the stuff. We still have in our holiday, but this is very important cause. And we are here today to share and discuss with our great partner, IAEA, the exciting new program that the Islamic Development Bank and the International Atomic Energy Agency has partnered for financing, for expansion, for access of cancer services in the low and middle income developing countries. And before I discuss with you the partnership and the aim of the partnership, I would like to share with you a video we have developed to share with you and talk to you about, explain about the aims of the partnership. So go ahead, please, and play the video.
The fight against women's cancers has received a major boost that could help save over 5 million lives. Breast and cervical cancers are largely preventable or treatable in richer countries, but are often a death sentence in the rest of the world. Most of these deaths could be avoided if modern prevention measures, cancer screening, and treatment were in place. The Islamic Development Bank has joined forces with the International Atomic Energy Agency to mobilize the funding and expertise needed to tackle this issue. Saving Women's Lives from Cancer, a global initiative for breast and cervical cancer control, will bring the international community together to deliver tangible results so that more women will have access to treatment. Between 70 and 90% of breast and cervical cancer patients require radiotherapy, but it is often hard to access. The projects funded by the new initiative will expand breast and cervical cancer control programs, including the upgrade of cancer facilities and the training of cancer care professionals. The bank has committed an initial $10 million US in grant funding, and the partners are now seeking other technical experts and donors to contribute to this important initiative.
Millions of women around the world, but in particular in developing countries, are dying because of cancers that are perfectly treatable and curable in many other places. We have the technologies, we have the science to do that, and we have the resources. It's time to put this together and put an end to this tragedy.
The partnership between the Islamic Development Bank and the International Atomic Energy Agency will widely address cancer prevention, screening, diagnostic, and treatment of women in our common member countries. This partnership will contribute to saving the lives of up to 5 million women from breast and cervical cancer over the next decades.
Help us to save lives and join the global effort in fighting women's cancer.
Thank you very much. If I can have the next slide, please. Yes, so I'm going to spend just 1 minute to highlight, and most of you, I think, know about us as the Islamic Development Bank. We are a multilateral bank, one of the largest and active multilateral bank. We serve 1.7 billion people around the world. We serve 4 continents. We're AAA bank, and we're the leading in Islamic finance. And we serve also 57 countries, and 21 of them classified as least developed countries. So these countries face many challenges, economic and social challenges, including low quality of healthcare, poor education, poor water and sanitation accessibility, shortages of renewable energy, and are very vulnerable to any environmental disaster. And of course, they are facing also debt and high unemployment. Next one, please. And that's why health, it is always a priority to Islamic Development Bank. And always there is an urgent need for to scale up diagnostic treatment for women's cancer who suffer from cancer. And according to the and our partnership with the IAEA is actually to set up a new a national, as you can see from the slide, a new national cervical and breast cancer program. What is called, we call it now, Saving Women's Life from Cancer. And according to the IAEA, for research on cancer worldwide is about 8.6 million women suffer from cancer, and they may die from preventable and treatable cancer. And that's why, next slide, please, is not, and that's why also is very, the situation is worsened in the low and middle income countries in our member countries, and also in the IA also member countries. And you can see here from the slide, it's not fair. Women who live in Jordan, for example, have less the chance to survive from breast cancer, and especially look at Mali, if you can see from the slide, only 14% compare with Australia or Brazil. And also the same thing for cervical cancer. Women in a developing world, or least developed world, they can have 6 chances more to die from cervical cancer. Could be with the $10 vaccine could be preventable. And you can see compared with Tunisia and Korea. And that's why, next slide, please. And this is why the Islamic Development Bank for a long time has committed to the global fight against cancer. And also you can see here from the slide, according to also to the IEA, 50 seconds we lose a woman. Imagine how much we lose per day from breast cancer. Next slide, please. And from cervical cancer every 100 seconds. And since 2013, the ICDB has approved about $346 million in grants and loans for cancer control program in partnership with the IAEA and common member countries like Senegal, Djibouti, Niger, Guinea, and we really value the partnership with the IAEA for their expertise in the technical expertise, in the capacity building, and also in education and training. And that's why this partnership is going to be really an amazing partnership, because we're creating a new platform to have this special program, the holistic, in terms of education, in terms of awareness, in terms of financing, in terms also of innovation. We set up a call for innovation to seek the brilliant mind around the world to tell us who are really have the latest technology or related innovation for capacity building or to cure or diagnostic for cancer diagnostic. Next one, please. And hopefully, inshallah, we'll see always with this partnership, we are aiming to have impact to save about 5 million women for the next 5 years with this partnership. 1 million for the breast cancer and 3.7 or nearly 4 million for cervical cancer. The next one, please. As I said before, global goals is a new era, and to accomplish the global goals is really the financial development or development in finance will raise, will move from billions to trillion. And as you know, the global goals is a universal call to all of us to look after our planet, to make sure that people live in dignity and prosperity. And we're happy to see with this partnership we can accomplish or address many global goals. And this is just the start, like global goals number 1, number 3, number 4, quality education, gender, which is really important because, women, why poor women, they lack, the rights, they have the right, the basic human right to get access to diagnostic, to get access to the treatment. Being poor doesn't mean you have a hope and you don't have dreams and you are not intelligent. So really, this is the one of the things we are focusing with the IEA to inequality and injustice in terms of how we can access to the poor countries around the world, and especially in our member countries, that type of program to save women to die from cervical and breast cancer. And also we're addressing with this the peace and justice, as I mentioned before, and also the partnership, which is the crucial SDG, I think, for all of us. And that's why today we have this webinar. Next one, please. So the partnership with ISDB, we value that it is a key priority, is a key pillar of our mission in the new mission of His Excellency Dr. Bandar Hajjar partnership, and especially partners who are really share with you the value, who are amazing, having their own contribution toward humanity. And we have this instrument under His Excellency initiative called 5Ps, which is a partnership between private sector, public sector, philanthropic organization, and also people, civil society. And what we call here is an innovative idea of blended finance. So everybody can join this partnership. Nobody will be left behind. Anybody with expertise, anybody would want to donate, somebody will innovate, somebody wanted to really invest, and also in civil society organization. So we want to make sure that this is a cause for everyone can join. If you have a $10 or you have 100 million, all of you is available. If you have a training program, if you have education program, if you have a center who can just talk to women and make them aware of really how they can look after their girls and make sure that they have the vaccine. That's also an amazing, you're saving lives. So that's why the whole idea of having this webinar, to have the whole partner, all type, nobody, as I mentioned, left behind. Everybody is welcome to be able to join us in this an amazing, exciting program with our valuable partner, IAEA. And here I will be quiet a bit because I want to leave the floor to really my dearest partner here, Lisa Stephen, who are really the direct impact in the IAEA. And over to you, Lisa. Thank you.
Thank you so much, Dr. Hyatt, for introducing the concept of the partnership. I want to thank you today for the opportunity to be able to highlight the important role that IAEA plays as a technical partner in this initiative. Next slide, please. The IAEA is part of the UN family, and we are a science and technology-based organization, and we have specific technical expertise in both cancer diagnosis and treatment. Next slide. IAEA has a very unique mandate to support our member states to peacefully, safely, and securely use nuclear technology. Specifically for the context of this partnership, that's in the arena of human health. IAEA supports the building of capacity and infrastructure for member states to be able to use radiation for cancer diagnosis and treatment. And we specifically focus on the transfer of technology and expertise directly to member states. Next slide. The IAEA and the ISDB have been partners for many years and have successfully implemented projects in our common member states. The Director General, Mr. Grossi, is very supportive of this partnership and this initiative to provide assistance to cancer patients, as noted in the quote here that you see on the screen. Next slide. As an agency, we have more than 60 years of experience assisting member states to improve radiation medicine within the country. We have invested our own money, more than 172 million euros, to support cancer-related projects in member states. And we currently have around 115 cancer-related projects with our member states to be able to transfer nuclear technologies to address cancer. Next slide. So as you've seen, cancer is a growing burden, and it's a growing public health problem, with the burden falling unequally in developing countries. The Women's Cancer Partnership Initiative will help to reduce these inequalities. And you've already heard Dr. Hyatt talk about the disparity between developing countries and developed countries. And so I won't reiterate that, but I'll go ahead and move on to the next slide. And note that a woman dies every 50 seconds of breast cancer, and 66% of these deaths are in developing countries. So why does IAEA make sense as a partner? Well, nearly 90% of breast cancer patients are recommended to receive radiotherapy, either alone or in combination with other treatments. And IAEA is uniquely positioned to support our common member states in the development of capacity and infrastructure to provide this service and to save lives. Next slide. For cervical cancer, roughly 70% of the women will be recommended for radiotherapy. And for advanced disease, radiotherapy is the only curative treatment. With one woman dying every 100 seconds from cervical cancer, the need for access to radiotherapy is very great in developing countries. Next slide. IAEA can support countries to put radiotherapy into the context of a comprehensive cancer control program, and this will help to save millions of lives. Access to radiotherapy would have a tremendous impact on vulnerable women and girls, ensuring that they receive comprehensive services they deserve, with the long-term impact on their lives, their communities, and the economies of their countries. Next slide. As you've heard, this initiative supports many of the SDGs. And I will just say that for 1, 4, 5, 16, and 17, which Dr. Hyatt went through already, these are really all under the umbrella of SDG 3, which is good health and well-being. So not that 3 is necessarily more important, but we're focused on health, and we're also able to support member states in fulfilling their other commitments to the SDGs. Next slide. So we're looking right now to expand beyond the generous support of governments and private sector that we've received to date to support this joint initiative. When joining this partnership to save women's lives, you have the opportunity to join other global players, including other UN organizations like UNDP, UNICEF, and the World Health Organization, who are already working together to improve the health and social welfare of women and girls, and to improve access to life-saving treatment for breast and cervical cancer. Next slide. We've had many supportive partners over the years, and we have made progress. And together now with the Islamic Development Bank and under the Saving Women's Lives from Cancer initiative, we have the opportunity to do even more with your help. We want to add you to this list of supporters and partners. Next slide. So again, I thank you for your attention, and I'm looking forward to the question and answer and the discussion.
Thank you so much, Dr. Lisa and Dr. Hyatt. For the center, it's really been a privilege working with both of the organizations in this endeavor. And, and special thanks to Dr. Hyatt for bringing us, early on into this process. So I'm going to talk a little bit. I know right now I wanted to give you an overview. We have over 200 live stream participants right now, and we really want to thank those live stream. And for the live stream participants, if you have a question, there's a way to submit a question. And also for the attendees within the webinar, if you have questions, just raise your hands. So next slide, please. So one of the things in terms of the center's work with the initiative, we've worked on blended financing partnerships in the past. And for the audience members, we really want to focus on the positive impact that this initiative can do when we combine the different expertise. We know from the demographics we're running right now on our live stream audience that we have government participants, we have NGO participants, we also have philanthropic participants and private investors. And we really need all of these different wheels, as both Dr. Lisa and Dr. Hyatt were talking earlier, to combine together, to really move. And therefore, we need all of your expertise, both financial expertise, but also strategic expertise. And one of the initiatives that we worked with was with the Canadian government, and then also in terms of, maternal health initiative. The way that these initiatives really were able to capitalize and really raise sufficient funding was, as this initiative has started. There is an initial investment right now that has been made by the Islamic Development Bank. There is the catalytic support of the International Atomic Energy Agency. So we need the partners right here between those in the live stream and the webinar to really continue working with us so that we can catalyze these wheels together. Next slide. When the capital flows in this way, and we have the different strategic investors, the impact investors, the grant funders, and the fiduciary investors coming together in what's called a waterfall capital, which some of you know in many ways, and others of you are familiar from the blended financing work that your governments are doing. That capital can create a tidal wave of how we address and have resilient health systems to be able to tackle the problems for breast cancer and women's cancers. So that's really, where we're here, and we look forward to working with many of you, both on the live stream and also on the webinar, to make sure all these capital flows come together so that this initiative has a lasting impact for many decades to come. So thank you. I'll stop there. And I'd like to open it up to some Q&A. But before I do that, I just wanted to see if Dr. Hayat and Dr. Lisa had any other additional comments.
Me, it's fine. We just want to really share with our attendees if they have any question. We're happy to hear from them.
Exactly. No additional comments from me. Thank you.
Great. So we'll turn it over to the audience. And so in order to ask a question, all you have to do in your monitors is just press raise your hand. And then you'll be moved over to the room. Okay. So while we're moving some of the audience members over, okay, I see a hand. Alan, if you can move the audience member back into the room to ask a question.
Yes, good morning. And this is Anthony Siciliano from the Center for Global Health and Development. Thank you, Dr. Hayat, and thank you, Dr. Stevens, for wonderful introductions. We truly appreciate your partnership on this wonderful endeavor. I'd like to ask Ms. Manrique, if I could, about why CGHT saw the need to start cultivating relationships with the private sector, and how CGHT thought engaging the private sector could help initiatives like the Saving Women's Lives from Cancer, and how that could really truly create an initiative that could have impact on billions of or millions of women's lives throughout the world. Thank you.
Thanks, Anthony. I think in order to create these partnerships, because we worked in the past with many governments and other UN agencies, you need the right, you need basically the right political will to do it. And I think the combination of the International Atomic Energy Agency and the Islamic Development Bank being a bank with the financial expertise to be able to deploy a blended financing mechanism was what really, I think, sets this partnership aside from others, and also having the expertise of on-the-ground implementation with IAEA. So I think for our private investors, both on the, the webcam, this is a very interesting opportunity. I see a question from Tom. If we can move Tom over. Tom, your speaker has been enabled, so you can ask your question.
Sorry, apologies. I think that might have been a mistake. I didn't mean to raise my hand there. Apologies.
Okay, I know that there's a question from Direct Aid. We can go ahead and unmute.
Hi, Yusri here from IDB.
Okay.
Okay, I think this is really a good initiative when we talk about blended financing on 5 Ps. So we're bringing over all the related parties to be with us as one partner to deal with the breast and cervical cancer initiative. Yes, 5 Ps is very important. We talk about various partners. One more important area where we need to have one mindset together with the initiative, because the challenge really on the how we can bring together the public mindset, private mindset, and philanthropist mindset to come together, because to have blended financing with this sort of different mindset is very challenging. So how do you see this challenge towards the launching of the program later on? Thank you.
I'll turn those questions over to Dr. Hayat and Dr. Lisa.
Sorry, is that a comment from Yusri or just a question? Because I think I hear it more like a comment about how 5 Ps is really crucial. As I mentioned before in my presentation, now the way of mobilizing, resource mobilizing is different. Especially with COVID-19, and we had Ebola before, and with the global goals, people facing challenges I mentioned, and high employment, and also poor quality of healthcare and education, and the basic right of for any human being really to live and survive and to function and to live. So in terms of like to blended finance, how really we're going to make sure that we source mobilize. There are a lot of money exists in a global market, but we know the key thing how to mobilize it and how really to attract the right I can say donor or philanthropy or partners I mentioned with your goals and with your causes. So with the blended finance, with this initiative, we wanted to create a fund at least for $500 million to be able to address the challenges that we face in cervical and breast cancer. And I did mention earlier in my presentation, we want also an innovative way of finance to be able, and this is now the blended finance is for innovation, blended finance for great causes. Actually, people feel they can be part of it because really they addressed the private sector, the government, the public, and also the donors. And things that we did with the Islamic Development Bank in terms of innovation, we did open a call for innovation, and we already now we're going to announce the winners for that in the IAA annual meeting they have in September. The idea about that, how we can blend innovation and great minds who are really feeling the problem, who are really being there for a long time to address these challenges, and they need the right source of finance to be able to believe in their ideas and to expand and sponsor and support. And we had amazing number of around the world because we opened it to everyone to let us know what is really the latest development in the diagnostic for cancer. What is the latest development in the capacity building? How are you going to change the health system within your own country or within your organization or with your own community? And we had amazing ideas, and we shared, of course, with our partners, and we're going to select the top 4 at the end of this week, and we're going to announce it, inshallah, in September. And the key thing about this is really how we're going to not ignore innovation and science and technology, which we can see that from COVID-19, this is the priority now. How we're going to really help the creative mind to be able to carry on with their own, mission and new ideas to be able to overcome the challenge, because as you see, there's always going to be a challenge, always going to be innovation, always going to be a new idea for treatment, better idea, cheaper idea. The most important thing, how we can make that affordable. When I was at Harvard, we had to channel our ideas how we can make affordable diagnostic for people who live in a rural area with no electricity. We need to really challenge that. We need to channel as well that type of thought. So blended finance also include all of that, because to have a low diagnostic for breast cancer or cervical cancer, to have a great system to capacity build and able have the training and to save life. This is also saving lots of money, and this is a way of also of blended finance that the Islamic Bank also cherish to be able to sponsor and support and also to scale up with the world. And maybe over to you, to Lisa, if you want to have also comment on that, because you've been with us through the process.
Yes, so I'll take the blended finance more from a technical point of view to complement what Dr. Hayat and Joanne have already said. And the bottom line is we need the contributions and the input of multiple different types of partners. And it goes to the question that Enrique asked as well about why the private sector. Because again, we're looking as a technical agency, how to integrate the ability to advance diagnosis and treatment in the context of a comprehensive cancer control system. So we really need to engage the ideas and the input and the financing from a variety of different partners. And so that's what I would talk about, the need and the innovation of blended financing, to blend these different entities together to be able to look at this solution comprehensively and not in a siloed way.
Thank you, Dr. Lisa, and thank you, Dr. Hayat. I think on one of them, as you know, we're looking at the live stream demographics, we have foundations. We have quite a few foundations on the line, as well as governments. So in terms of the role of, governments, and then also in terms of the role of foundations, one of the things I'll comment related to innovations and also the fund that's being developed is their catalytic capital right now in these early stages is so essential. As much as 50 million or 25 million can totally change the perspective on how these funds are created, because an investment of as little as 25 can catalyze as much as another 250 to 500 million. So really, thank you to those governments and foundations right now on the phone, and also to Dr. Hayat and Dr. Lisa. How do you see the role of these governments and foundations playing in terms of the role they can play in catalyzing innovations, and also helping to catalyze this initiative overall, not only financially, as I just mentioned, but in terms of other roles they can play. And then I'll also turn it to some of those audience members as well, but I'll turn it back to you, Dr. Hayat and Dr. Lisa.
Thank you, Joanne. I also wanted to ask one of my team member to highlight, but I wanted to say, you mentioned it in earlier, and also Lisa, you need a political power. You need also civil society organization embedded within society who also have a power to be able to channel the type of resources toward these causes. When you come to, I'm glad to see organizations from government and civil society from NGO are really joining us today, because this is very powerful in terms of the whole ecosystem or stakeholder need to be involved. Without the political power, without government leadership, without also the civil society power in terms of understanding, and they are embedded within the whole society, who being there in the field, feeling the patient, getting them all the accessibility, and also the private sector, as you mentioned, we need all the stakeholders. Without them, it cannot be part of the equation, because decisions and instruments implementing the decision is a key thing, because here we're looking for instruments, laws and policies. Without the laws and policies, there is no infrastructure, will be no strategy to be able how to move that forward. If you know your country, the highest number of women die from cervical cancer, definitely there will be a decision, political decision, to be able how I can be access to get accessibility to that. Who will be my partner? Who will be my global partner? How am I going to embed the innovation here? How I'm going to get the private sector to invest in building hospitals and treatment? So that's all the stakeholders needed to be part of the equation. And maybe here I can ask either Abdelgader Al-Hashimi or Amar Abdul of my team to talk about this blended finance and why we need the whole stakeholder to be part, as we mentioned here in this initiative, because it's an important initiative. Is a whole family affected? Is the whole society? You know, when you lose a woman, the whole family will be affected. It's not an easy thing. So that's why we need this political and also investor and private sector and philanthropy be part of this type of thing. So please, if either of you, please, Abdelgader or Ammar, to comment a little bit for 2 minutes, and then of course the floor to Lisa.
Yeah, here Abdelkader. Yeah, I mean, I think the important thing to keep in mind is what we have seen in this introduction. We have seen, I mean, the thing that I keep remembering is that the disparity is between the countries who have the resources, who have the money, and those who don't have the money. So the heart of the issue is really, the resource allocation. The issue is not necessarily in the technology, is not necessarily, in how we innovate, in the way we actually fix the health issue. Is just having enough resources for the countries in need of that to be able just to basically apply the same methodologies, the same processes, the same health solutions to the countries. So I think the heart of the discussion is around allocating the resources where it needs to be. And I think this initiative is trying to fix that problem. The initiative is really a partnership. So it's a partnership between the Islamic Development Bank, is a partnership between the IAEA, but it's actually beyond that. The full idea is to have a platform where everyone comes together, everyone becomes a partner, and together we find the right solutions. Whether it's financing, we can obviously create models and structures that fits each and every need. But the idea is really to bring people together, to work together and provide solutions to really save lives. So I think the idea of the platform is beyond the blending or finance, or is actually in line with the blending financing. The blending financing is what is just bringing different people with different perspectives and actually merge the different objectives and fix a financial issue. And this is where obviously the government and the supranational institutions will have their role to play. Investors who obviously are looking for different sort of outcome have also their role to play. And the idea is to bring all these resources together, this money together, and try to align the objective. The final objective is obvious, to save lives. And I think we need, as a partnership, to work together to see how everyone can contribute to really fix the problem and save lives where currently you don't have the resources to save lives. It's just a matter of resources. So I think the first things is the willingness to save lives, is the willingness to participate in this partnership. And if we have that, then structuring, blending financing, etc., that's not I think the heart of the issue and where we will have problems. We will discuss this and we will find the right models, the right structure for the right projects we want to actually fix. So I think again, to me, I mean, if I have one comment, is like let's really believe in that. Let's have the willingness to save lives, and together we will manage to do something as partners. Thank you very much.
Thank you. We have a question from our live stream audience. It just got texted over to me. It says, this is Richard. I've invested in both foundations and grant capital and then also philanthropic capital as well. The question is, how does IAEA see the role of UN agencies in helping governments, private sector, and philanthropies come together to solve SDG priorities given the COVID realities? The question is also posed to the Islamic Development Bank as well. Thank you, Richard, and I'll turn it over to Dr. Hayat and Dr. Lisa to answer the question from our live stream.
Ask Dr. Lisa to start because we've just been over here at the chance.
Thank you, Dr. Hayat. Yeah, so I do definitely think there's a role for all of those entities that Richard mentioned to come together. And in part of what I was going to say to the last question is really, we need the governments to contribute, and the way the IAEA does that in terms of our technical cooperation program is through government cost sharing. And what I think, and Dr. Hayat as well as Abdelkader have signaled, that shows the private sector, the NGOs, the foundations, that the government is invested in improving the lives of women with cancer. And so that is part of the response also to, in light of COVID-19, what we've really seen is health systems are struggling no matter where you are in the world. And so as countries come back online and start to provide basic services, cancer screening, I do hope, and other activities, it's going to require a whole of government, it's going to require NGOs and private sector to say, how do we rebuild the health system so that not only we're able to be flexible and resilient in the face of a future pandemic and in recovering from the current pandemic, but also how do we make sure that basic services like cancer screening and cancer treatment are able to be provided in a holistic way. So I do see that the UN plays a key role along with our partners at the bank in private sector, governments, and NGOs. So Dr. Hayat, I turn it over to you.
Thank you, Lisa. And also I want to make a comment here. It's very important, and that's actually reality. Government here is a critical, and I see that when Dr. Bandar Hajjar been addressing these issues with head of states, because when you wanted to bring a private sector to a country, it doesn't have the bylaws, it doesn't have the guarantee, it doesn't have the security, it doesn't have the insurance. It's very tough to get them to attract them. And I've seen that when His Excellency been talking to head of state, and really the head of state took this initiative and really provide the right environment, because everything you want to do in life, doesn't matter what, you have to have the right environment to grow or to nourish. If you didn't have the right environment, everything will be dead. You know, it's just a plant in your office. If you don't water it, you don't have a sun, it's just a plant, it will die. So what about like investment in healthcare in least developed country, which is a lot of regulation and a lot of also insecurity for the private sector. So we've seen that change when the head of state really committed and also helped in connecting the dots in terms of making that easier for visa or bylaws or accessibility, whatever it takes to make it easier, because we need to really have this open type of, way of business, or even with the open science, where I come from, to be able to, have no boundaries. The boundaries is really humanity, how really we're going to help humanity. And I've seen that in my own, when we go to the official trips, and how that change in terms of because we are being, as Lisa mentioned, as a UN organization, will respect it, and also ISDB will respect it. So I've seen how that changed with the decision maker. It's very important how this science policy or change policy or private policy interface. That's very, very crucial. I agree.
Thank you so much. And I see we have a question from Sharifa. If you like to unmute your phone, or if not, I can read the question that you posed.
Actually, I'll unmute. We currently I want first to thank you all for this opportunity. This is a great partnership, and we look forward to the fruits of this partnership. I represent Zahra Breast Cancer Association, and we have been engaged with several government partnerships, and we always struggle with financing. And I was looking forward, if we have ready business cases and ready partnerships that require funding, what is the practical steps to get the funding? If it's not the case, what's in it for us going through this partnership as an NGO?
Dr. Lisa and Dr. Stevens, I'll turn over the question, and before you answer it, I'll give you a few moments to answer it. But one of the things that I think both this question highlights and the previous remarks, and some of the things we're getting from our live stream audience is really one of the governments commented that the beauty from the blended financing is that it combines all kinds of capital grant, equity, concessional, lending, and the initiative really offer all types of donors to participate, and that NGOs can find support also through donor contributions. So thank you for our live stream audience, and I'll turn over the question back to Dr. Hayat and Dr. Lisa.
I will ask please Dr. Lisa to start, and then I'll comment because I know the organization.
Okay, great. So I think to answer your question, the one that you posted online about how to make use of the partnership, and I hope this goes to your specific example, is that right now many of the member states are developing proposals to respond to the ability to enhance services in breast and cervical cancer, so in diagnosis and treatment. And so it's really, to make use of the partnership is working with the entities in the member states, the ministries of health, the ministries of finance, to be able to look at some of the needs that maybe you've identified within the Breast Cancer Foundation, to be able to say this needs to be included in the proposal for funding. This needs to be addressed. This is a gap area, and you as a foundation would be able to help implement the project if it is funded. So I will turn it back over to you, Dr. Hayat, but I think again, it's really in working across the different sectors in a given country to be able to ensure that the project proposal is comprehensive and looks at those gap areas.
Thank you, Lisa. So I just want to say that Zahara Foundation, I think Sharifa, we're very proud of the organization. As I know, Her Royal Highness Princess Haifa, when I was in the Shura Council, and how she was very active with this organization and in terms of awareness for breast cancer in Kingdom of Saudi Arabia. So I know finance, as mentioned, Abdelgader is important because here we're talking about finance, but also finance is part of it. But the other part, what is for you, I think all of us has a part of this, not just only finance, because you are on the ground. Yeah, you have a data, you have accessibility. I mean, join forces with this initiative also provide for us a new window, new information about, as Lisa mentioned, how really we can address this issue with the Ministry of Finance, how we can address this issue with Ministry of Health, because government need to be part of this as well. So I know, the NGO sometime, well, most of the time, they're seeking grant funding in terms of donation to be able to carry on with their amazing causes, but also join force in the same of this type of initiative. We can, all of us, learn from each other expertise, and also we can help each other in terms, really, what we need in terms of your initiative, our initiative, as together how we gain the impact of our partner here and join forces to move forward. So everybody has something for it, and as I mentioned, the data, the accessibility, the experience, the cases that we know about what's happening really here. Also, there's a powerful thing that how we can articulate in terms of addressing government and private sector, and also open a window how we can invest here in the kingdom or on the Gulf in terms of cancer treatment awareness, and especially in the. Also, I want to mention that what Lisa mentioned, educational system is also crucial here. For young girls, how we want to educate, because the taboo sometimes for in the Muslim community for women, if she's suffer or she diagnosed for cervical cancer, or she doesn't want to go for diagnostic or for treatment or the vaccine. That's also need to change that, and you have a power of that because you've been there on the ground. You've been talking to millions of women and young girls. So that's also a great partnership. We're looking forward to have it with you.
Thank you. We have a question from Nicole from the Gates Foundation. How do we measure impact effectively. There have been many public-private partnerships initiatives, but sometimes it's difficult with so many partners, both UN and development banks, to properly align in metrics in a way that we really know how social impact is made. It's easy to measure economic returns, but more difficult to truly measure social returns. So I'll turn that question over to Dr. Hayat and also Dr. Stevens, and just add, a bit of my own information. Having worked with both of these partners, I think in the development of the partnership, the true formulation of what we're seeing come together is amazing and quite unique to other initiatives in terms of, looking at not only the financial models, but also the impact made to the individual. Having been part of other, initiatives like Every Woman, Every Child and others, this initiative is truly, I think, unique because the brainstorming into how each of these things is going to happen along the way has been amazing to watch and really gives a lot of confidence in where the initiative is going. So I'll turn it back over to you, Dr. Hayat and Dr. Lisa.
I think Lisa, maybe she can answer that in more of technical and data way because they've been there for a long time. And I'm going to answer it from my own point of view as I've been in social innovation for many years. I think when I was giving this presentation for MIT about this NGO and the main impact is social, it's the first time ever, and an NGO apply for this competition, which is a competition all about economic impact. I think economical impact may be easier to mention, but it's not stable, as we all know. But for me, social impact is more steady and organic, and saving lives is an indication of that. Awareness is an indication of that. Less cases among young girls and women is an indication of that. The prosperity and the whole health system about training and increasing the well-being of that community is also an indication. And it's always going to be sustainable and steady because when you have the right foundation, if you are, as Abdelkader mentioned, and also Lisa and in my presentation, when you look at the developed world and developing world, why this change? Because the awareness, the culture, the accessibility, and the same thing, it will happen here, and that's the progress of that will can be measurable. Everything is hard to measure in the beginning, but the number of lives, that's very good indication of how much that's the impact of that. And maybe Lisa can add to my comments, but for me as a social innovator, how I know this could be as a turning point, and also just awareness, changing the direction and the mindset. That's also a great impact in terms of this initiative. Go ahead, Lisa.
Great. So thank you, Dr. Hayat. So I will say that that's a great question. And I think the bottom line is we need data. So we need to be able to track, and Dr. Hayat said it perfectly, number of lives. So we want to impact number of lives. And in the project proposals that the agency has, we're really looking at, number of individuals trained. So radiation oncologists, medical physicists, all those around the infrastructure of being able to provide radiation therapy. But once a machine is installed, you can look at the number of predicted people treated per year and say, okay, we've been able to actually deliver these machines, get them serviced and ready to go. And now we're able to treat these women. So if we put it in the global context of the global elimination strategy for cervical cancer, and we say that we know that one of the targets is 90% of women having access to treatment for cervical cancer, and we've talked about advanced cervical cancer, the only curative treatment is radiotherapy, then we can start to say, well, are we going to be able to achieve that 90% in the time frame that the WHO has set? So these are the types of metrics that we can start to put into place within the project proposals. We can also have milestone-based financing as well, so that as the countries meet various milestones, they're able to progress of the project. So I think it's definitely a consideration that we have to have at this stage, so that we're making sure that we're able to meet those milestones and report back on what we've been able to accomplish.
Okay, and I know Dr. Amamar has a comment. Dr. Amar, I think even though you're in the attendee section, you can, you're able to speak.
Go ahead, Ammar. Can you hear us?
Hey, Dr. Amar, while we wait for your question, we have, and I know we're going up against the hour, but with now over 300 users on the live stream, I just want to make sure we get a couple more questions in. And thank you again to the viewers on the line. So we have Veronica from PE firm. She's asking in terms of the impact. She wants to know how the project will manage investments, specifically in terms of how they may be identified, and then the impact measurement. So before Dr. Hayat or Dr. Lisa or anyone else jumps in, one of the things that, you know, as it has been mentioned at the beginning of the PowerPoint for Dr. Hayat, is the concentration on the 5 Ps. So really the projects that are coming into this are really specific in terms of, you know, women's cancer and looking at the health system that makes women's cancers resilient. And that's really what is so brilliant about this type of investment vehicle. It is that it not only has social impact, but it's broad in that it's looking women's cancers and the health systems around them. But I'll turn it over to Dr. Hayat and Dr. Lisa to give any further thoughts on that as well.
Thank you, Joanna. I'm going to ask either Yusri or Abdelgader to comment, because, you know, to decide on the investment or investors in this type of work, it's also individual case by individual case. But we have like a common ground. We have a common laws for anybody who want to join as an investor or as a donor or philanthropy. Everybody welcome. We have term sheet, of course, for each different type of partnership. But in terms of that, how we can decide depend on which country, depend where exactly, and depend the size of the investment and what we're trying to achieve here. So if you want to highlight Yusri or Abdelgader on this, please welcome. Abdelgader, can you comment, please?
And just for all audience members, you've been unmuted. Yeah.
Yeah. Okay. So I think now we're good. I think maybe I can speak now. Are you hearing me?
Ammar, you want to give the floor a little bit to Abdelgader? I want to comment on the investment part. Ammar?
Yes, Dr. Hayat, I'm here, but I'm waiting. Abdelgader?
Okay, you can go ahead also. You can answer the question. I don't think it's all of us, you know. Go ahead, Ammar, you can answer the question regarding the investment.
Okay, thank you, Dr. Hayat. Indeed, we have many requests coming from various member countries. So this request, as Dr. Hayat and Lisa have highlighted in their presentations, so we have a different components. And under this different components, so a project, we have different components under one project, and the interest is varying from partners or from donors to others. So what we are looking mainly is to capitalize not only on financial level, but also on technical level and the expertise that some partners have gained over the years in working against these diseases. So if we came up, for instance, for the NGOs will be more looking to all components related to social mobilization. or to involving communities, awareness, raising awareness, mobilizing communities. So that's where they are interested. For instance, we have Direct Aid with us today. So I'm really calling them also to talk, because they are doing a great work in many African member countries. So that's one. The second, we have the private sector. And as you know, private sector are more looking for infrastructure because it's an asset for them. And it's a warranty also to invest. So they will be more looking to contribute to building hospital or to equip them. This is the room, but not maybe in the hard to reach areas or in the difficult areas. So there where they could invest. And we have also some, I don't know if our partner from General Electric or Siemens are with us today, so also they may emphasize on it. The third part is we have also all what's related to the capacity building. And here where we have the important input also of our partner like IEA. So this is under their mandate. They have grants support to help the member countries. Moreover, so the investment also could be through the technical assistance. And the technical assistance, so some investors are looking to de-risk their investment. And so they will be contributing in having bankable projects, which will reduce the risk of over time, the risk in terms of operations, and by that the implementation, and also in terms of returns. So just to stop here at this level, and then maybe if Abdul Qadir join us, he may complement me. Thank you.
Thank you, Ammar. I was just unmuted before, but thank you very much for this. I was just maybe just to add on the investment type of contribution. Obviously, we'll have a pipeline of projects. Let's call it projects. We could call it investments that will be provided through, I would say, the connections of the partners. So everyone will be, I would say, free to fill the pipeline. So we'll have ISDB, for example, receiving on a regular basis projects requests from the member countries. So those projects will feed the pipeline. We'll probably have projects from the IAEA and other partners. So that will constitute obviously the pipelines, and the pipeline will be filtered and go through some sort of different processes of filtering whether the viability, the possible outcome for the, I would say, investable or bankable project. We also look at the financials, obviously, if this is viable from that perspective. This will be presented and submitted by a board. So basically, people will go through it, experienced people, they will analyze that, they will filter, and then we'll go forward to a more technical committee. We could call it investment committee from a PE point of view, but we could just call it a technical committee, which goes through the proposals and filters where they are viable, where they will have an impact, and so on and so forth. And then they will be submitted, obviously, to the board of trustees, who will manage this kind of final projects and give the green lights for implementation. So in terms of overall process, the pipeline, I think we already have transactions. Transactions will be fed, and I think there's a lot of needs in different countries. So that will obviously will come. And the filters, as I said, there will be a process. There will be some sort of policies. There will be some clear criteria on what kind of projects fit in and what kind of projects are out. So that will be made in a very transparent way. Go through this various committee, and obviously the implementation will happen afterwards. Thank you.
Okay, thank you so much. And I thank you for that. And then for our live stream audience from the private sector, we do have your emails when you sign in, so we will be sending additional information to that to you directly. So thank you for that. I know we have from the private sector over 80 participants, so thanks again. We have from Direct Aid. I want to yield the floor to Direct Aid because I know that they wanted to say something. And all participants, you've been unmuted, so feel free to speak once you unmute your own microphone. Okay, I think while we're waiting for direct aid, we can take one more question. And I know we are short on the hour, but we have a question. We had a corporate, then we had a foundation. We want to make sure we take a question from one of the NGOs in the live stream. This is a question from Ming. And so as an NGO, Min wants to know, how will the fund determine combination of funding that projects receive? I believe some of this question has already been answered. Some projects may require different combinations of grant and equity or guarantees. And so how will the initiative support these projects? I believe some of this question has been answered earlier, but I just want to make sure to give some additional time for both Dr. Lisa or Dr. Hayat or other speakers from ISCB if there's anything else to add, or IAEA.
I think my team mentioned that in Sarah, but if Lisa, Dr. Lisa, you want to mention anything?
Nope, I don't have any. Yep.
And also, as Joanne mentioned, we can send them all the term sheets for all different type of finance. And as you mentioned, Abdelkader, will be a pipeline and projectable project has to go through that certain process and certain guidelines, very strict. And also there will be a board of trustee and everything will be joint with the IAA. But we have term sheet like any NGO or any partner or any private sector. There is always guidelines and certain steps people takes. But that's what I wanted to add. But I think Abdelkader and Ammar, I don't know if you three want to add anything, but I think we can send them the information as a package. As you mentioned, Lisa, Joanne, we have an email. We can send them more information if they're required for their committed partnership if they need or more information to know more about the initiative.
Right. And yes, thank you so much. And to our the live stream audience, we really appreciate your participation. We will be following up. As Dr. Hayat and Dr. Lisa were saying, we have now vastly over 300 of you on the line. So we see this as the beginning of a discussion with both Dr. Hayat and Dr. Lisa. We look forward to involving many of you in this ongoing partnership, as we bring on you in many different ways and your different expertise, both as we were saying in terms of catalytic capital, in terms of your NGO roles, in terms of your foundational roles, and also government roles. I'll turn it over for any final remarks to Dr. Hayat and Dr. Lisa, but thank you, everyone. We will be following up with each of you.
Thank you, Joanne. As I mentioned before, we really value this partnership. The cause is amazing, and I'm sure all of us been touched by somebody being in their family or close friends or neighbor by breast or cervical cancer, and now affecting young girls in about 18, 17 years old. So they have the future ahead of them, and we could really prevent and help them to survive, and they can start their own family and they can enjoy life and they go to education universities. Same thing with young girls, to give them the vaccine and protect them and prevent them. And all of us mentioned the inequality, injustice in terms of poor and rich. Okay, you have accessibility, that's fine, and that's here our duty, how we can make that accessible, how we can give people a chance to be able to have the basic right. We are here to really join forces, and please, we need you to be able to join us, because whoever you are, I'm sure your cause is very much similar. Otherwise, you won't be here with us today. And I really thank you, our partners, and especially Lisa and Anya, and whole team, and whole our communication team and whole my team. And also want to thank especially Dr. Bandar Hajjar, who really noticed and he really felt the need and the urgency to have this partnership and to be able quickly to do something in terms of having this $10 at least vaccination to women to can make them to survive the death. So imagine life and death, and we are here together and to join forces to be able to make sure that the impact will be benefiting humanity, especially girls and women in the least developed country who lack accessibility to hospitals, to cure centers, to training, to diagnostic, or for like healthcare because they cannot have them, or even just simple electricity that we take it granted for. They cannot have it to operate or be able to, to be safe to go home. So that's why we're here. And I hope that we have many series in the future, maybe Jawan can mention, to be able to see how you can, be part with us. And any information you need, please let us know. And over to you, Lisa, and thank you very much from the bottom of my heart for your commitment and for all your team, for your really dedication and to be partnering with us in this amazing cause. Thank you.
Thank you, Dr. Hyde. And I will just echo that it's great to be a part of this partnership, and we have wonderful teams behind us who are really helping to support this. And I just want to say what makes this most delightful is the focus on women and girls in the most vulnerable situations, and how that we can join together, bring in additional partners in order to improve their lives, improve their communities, and as Dr. Hyatt said, give them a future. So thank you to all who gathered today. And again, I really think that there's an amazing opportunity here to make a difference.
Thanks again, and we'll be following up with you. Thank you for joining us from all over the world. And so we're seeing people coming from Asia, Africa, Europe, and really amazing turnout with the government's private sector. So thank you to all of you. Thank you, Dr. Hyatt, and thank you, Dr. Lisa. We'll be following up with the details that were mentioned. And also, we do have a series of other webinars to continue later in August. So by then, we hope to advance conversations with each of you individually. Thank you again.
Thank you.
Thank you.
Stay safe.